Hi, thanks for tuning in to a new episode of the Doctor Podcast Show. And this is episode number 60. And we'd really appreciate it if you subscribe to Doctor Podcasts and also click on the follow button. And if you like this episode, which I'm sure you will, please click on the like button and also repost this broadcast. We'll really appreciate that because it allows us to get even more and even better guests in the future. So today we have a very interesting and also very important program. We're going to be discussing a topic related to BOTOX. Everybody's heard of BOTOX. It's a very popular medication and drug that's been used for many years. And its main use is to treat wrinkles and eliminate wrinkles on the face. It's used for cosmetic reasons. It's injected into the face and it gets rid of wrinkles. But in recent months, there's been a problem because there's been counterfeit Botox or fake Botox being used in several states around the USA. And unfortunately, some patients have had very serious complications from that. And we're going to discuss that today. We have two great guests today who are experts in this area. We have Dr. Christine Thomas. Dr. Thomas is the medical director of the Tennessee Department of Health. She's also with the CDC as an epidemic intelligence service investigator for the CDC. She's fellowship trained in infectious diseases, and we'll find out why that's important with Botox. And she's also an internist. And she's recently written a paper which was published by the CDC just a few days ago about this Botox problem. Our other guest is Dr. Roisin McElroy. Dr. McElroy is an emergency medicine physician and specialist. She's also an investigator for the New York City Department of Mental Health and Hygiene, and also in the Bureau of Communicable Diseases, which also relates to infectious diseases. So I want to thank you both, Dr. McElroy and Dr. Thomas, for appearing on the Doctor Podcast Show today. I really appreciate it. Thanks for taking the time from your busy schedule to appear today. So I'd like to start by just mentioning that Dr. Thomas, you recently published an article in the CDC about several patients who developed severe complications from being injected with counterfeit Botox, and that occurred in the states of Tennessee and also in New York City. There were 7 women who became ill after getting these injections, and 4 of them required hospitalization, and 2 of them were in the intensive care unit. Fortunately, from what I understand, is they recovered, but they were seriously ill. Just as a background, Dr. Thomas, can you tell us what Botox is and what botulinum toxin is, and what is the difference between the two?
Thank you. So Botox is an injection of botulinum toxin, which is where they're kind of similar. This botulinum toxin, it's a neurotoxin. And so what it does is it blocks nerves from telling muscles to contract. And so the results are then the muscles can't tense. And so these are used in a variety of reasons to kind of loosen that muscle, including cosmetic applications and also medical treatments. When we talk about Botox, we use the term often loosely and just use it to refer to really any botulinum toxin injections in general. But I should also distinguish that the brand Botox refers specifically to botulinum toxin A, which is a product manufactured by Allergan or AbbVie, and that is FDA approved for use in the United States. So here you might hear us say Botox just kind of generally and to refer, but I also want to make that distinction. It is also a brand.
Right. So Botox, the brand, which is made by Allergan and now which is part of the AbbVie company, has been around for about 20 years. And millions of people have received Botox injections for cosmetic reasons, and it's also used for other medical purposes. which are all approved by the FDA. So what happened here? Why did these 7 women, and I understand there's about another 20 cases or so around the country in other states, get sick from these injections? What happened?
Um, so what we heard here in the health department was from physicians actually, and I just want to highlight the importance of physicians in this investigation, and seeing patients and then calling us and saying, hey, I'm seeing these symptoms. I'm seeing things like ptosis, difficulty breathing, weakness.
Ptosis is a droopy eyelid. I'm an ophthalmologist, so I see patients with ptosis, right?
Yes, yes, exactly. And when these clinicians were talking to patients, they asked about their history and they were hearing that these women had had cosmetic injections of botulinum toxin beforehand. And so, they called us and said, hey, is there really any possibility this could be botulism? And do we need to think about getting antitoxin? And we said, talk to the CDC, determined for reasons such as length since, symptoms started and everything, that antitoxin wouldn't be helpful in these patients. But it got us thinking, we don't get these calls all the time. And so getting this many in a row made us say, hey, let's take a deeper look and see what might be going on. And so through that investigation, we were talking to patients, we were learning more about the injections that they had gotten, and that led to subsequently identifying that the product used was counterfeit in the patients here in Tennessee. And so with that, we get concerned when we're hearing about counterfeit products because it's not FDA approved. We can't verify what's in the vial. We don't know how strong it is and all of these other questions. And so it really poses the question, were these illnesses and the severity of these illnesses in some way related to that counterfeit product that was being administered in unlicensed settings by persons who weren't trained to do so.
I see. So, Dr. McElroy, tell us what you found in New York City. What happened with these patients? What symptoms did they have, and how did you figure out that they were getting this counterfeit, not approved botulinum toxin?
So not dissimilar to the story in Tennessee, we were contacted by providers. In our case, it was, 3 isolated incidents that were not related epidemiologically, but the women presented similarly with these symptoms and actually disclosed to the provider that they had had recent BOTOX injections. And of course, the providers were concerned because 2 of these women disclosed that the person who provided these, that it was done outside of a medical setting and they weren't entirely sure about the product origins. And again, the providers contacted us at the Department of Health, wondering about the use of antitoxin. And similar to Tennessee, given the duration of time that had passed since injections and symptom onset, we recommended that antitoxin wouldn't be helpful either.
I see. So basically, these women thought that they were getting the real Botox made by Allergan AbbVie, which has a 20-year safety record. That's really great. But in fact, they were getting counterfeit botulinum toxin. And do we know where this came from? Where did this botulinum toxin that was counterfeit come from, both in Tennessee and in New York City?
I'll just step in and say in New York City, we haven't confirmed. We weren't able to get any of the products. So we haven't definitively confirmed that it was counterfeit, but we do know that it was unverified. And so we had concerns about the legitimacy of the product.
I see. What about in Tennessee? Were you able to confirm that this was counterfeit Botox?
Yeah, so in Tennessee, we were able to confirm this was counterfeit Botox. We worked really hand in hand with our FDA colleagues for this investigation. And so we were able to obtain photographs of the products that had been injected. And so in reviewing this, there were, several kind of red flags on the packaging that kind of raised this question of, is this counterfeit? For example, the package claimed to include botulinum toxin type A, which on the surface sounds, oh, that's,
Right.
consistent. But no, the Allergan product is specifically the onabotulinum toxin A. And so that was kind of one thing we noticed. We also, saw that the packaging claimed to include a 150 unit vial, which is not made by Allergan. Allergan makes 50 units, 100 units, and 200 unit vials. And then also there's misspelling of the city, the manufacturing city on the packaging too. And so these are all, very kind of tiny details that, if we weren't looking very closely at this packaging, I don't know that would have been, apparent. But, by having those connections with FDA and being able to really rely on their processes, they were able to then backtrack and confirm with the company, with Allergan, that this was a counterfeit product.
Wow, that's really incredible. Now I understand that also the people who were injecting the botulinum toxin, which was counterfeit, were also not licensed and trained to do this. Is that correct? Both in New York, tell us first in New York and also in Tennessee.
So we had definite questions about whether or not these providers were licensed. In two cases, the patient relayed that the injections were provided by a friend. And in one, it was sort of at a spa environment, certainly not a medical facility. So we definitely had concerns about, them being authorized and trained properly.
Right. So the lesson there is have a physician or someone else who is licensed to give this, and do it in a medical facility, not in somebody's garage or basement, right?
That is definitely our recommendation. And also to ask questions, like you as a consumer, are allowed to do so. If something seems too good to be true, or if you're concerned about the price or the environment, you should ask, are you authorized? Are you trained? Is this product approved by the FDA? Has it been purchased from a credible source? You as a consumer can ask those questions.
Right. I know I use Botox. I'm an ophthalmologist, but I have patients who want cosmetic procedures done around their eyes and forehead. So I always order my Botox strictly from Allergan or AbbVie. So I know I'm getting the real product. And that's important to know. Now, Dr. Thomas, you mentioned that these women were getting ill. Some of them had droopy eyelids. They felt weakness and other things. Why did they wind up in the hospital? You mentioned the way Botox works is it interrupts the signal between nerves and muscles. That gets rid of wrinkles if you use the correct and proper dosage. But if it's the wrong dose or if it's too concentrated, how does it cause you to wind up in the hospital?
Yeah, thank you for that question. I think a lot of that question about the mechanism and what happened physiologically, we don't have answers for. And I think there's a need to really be able to look at and kind of understand that aspect. What we saw here were people coming to the hospital because of these symptoms, because they were feeling short of breath, because they couldn't swallow. Very concerning symptoms to experience. And then kind of backtracking from there, as I mentioned, was, oh, what have you been exposed to, or what procedures have you had? What happened in the weeks leading up to these symptoms? I think it will be interesting to see, the botulinum toxin, the FDA approved botulinum toxin that we know about, tends to stay local. Can
Meaning
there
it
be
stays where
distance
you
spread?
inject it. It
Thank you.
doesn't go to the rest of your body. Is that
Yeah. Typically when it's used cosmetically, again, with all of those, approved products by people authorized to do so. But there's a question, we don't know what exactly was in this vial, and was there a chance for more distant spread of the toxin to then impact other parts of the body? There's a lot of questions, and we'll see it, studies in the future are able to clarify some of that for us.
Right. So some of my patients ask me frequently, well, isn't Botox botulism? Isn't that dangerous? And I explain to them that it is botulinum toxin, which is the same chemical or substance that can cause botulism. But the way AbbVie and Allergan make it is it's a very specific tiny dose so that it's almost impossible to get sick from it. Whereas if it's made counterfeit, you don't know what concentration the drug is in. You don't know how much you're getting, and it could be like botulism. So, Dr. McElroy, can you explain what botulism is and what the difference is between botulism and what happens when you get the legitimate FDA-approved Botox?
Christine, I'm going to defer to the ID doctor to talk about botulism, and I'm happy to field the question on like the differences between the two products.
Yeah, so tell us about botulism. My patients ask me a lot about
that. So botulism is classically a bilateral cranial nerve palsy, meaning you have problems with one of the nerves kind of in your face to your eyes, something like that. And then you classically and traditionally see a descending paralysis. And that can be, of course, life-threatening, especially if you know the muscles you use to breathe are affected in that. And so botulism as an illness is very severe, always makes us very concerned if we think we might be seeing it. Botulism is caused by a toxin, botulinum toxin, that is produced by a bacteria, Clostridium botulinum. And so there are typically two different ways that we see botulism, with some additions, of course, the rare additions. But one is if the toxin is ingested, it can cause what's called a foodborne botulism. The other is if a wound gets infected or has toxin production within the wound, you can also get a wound botulism picture too.
So if your muscles of breathing are paralyzed, you can't breathe and you could potentially die. I suppose that's why these two women wound up in the intensive care unit, because they were having difficulty breathing. But I understand it wasn't so severe that they needed to be put on ventilators, but still they got pretty close to being incredibly severely ill. Now, Dr. McElroy, in the study that I read, apparently in the New York City cases, you were able to figure out that some of this fake or counterfeit botulinum came from overseas. Is that correct?
So that information was relayed by the patient to the provider, and the provider told us at the health department. We haven't been able to verify that, but we did alert the appropriate offices at the FDA.
I see. And have we been able to find the injectors of the fake or counterfeit botulinum toxin?
So I know in New York City that the FDA is that is currently under investigation by the FDA. We haven't received any updates for them. I'm not sure about Tennessee as well.
The same is true at Tennessee. And so that investigation with the FDA, we haven't heard updates either.
Right. So for patients who are interested in getting Botox, legitimate Botox for their wrinkles, getting rid of wrinkles, looking younger, for cosmetic purposes. It's also approved for other conditions such as preventing migraines. It's approved for reducing sweating. It's also approved for some neurological conditions. How should a patient be sure that they're getting the real safe Botox made by Allergan and AbbVie? What steps do you recommend, Dr. Thomas, that patients take?
So I think there's three things that patients can take to make sure that they are getting the best and safest experience. And number one is to go to a licensed medical facility for their procedure for the injections. Number two is to make sure they're getting that from a trained and licensed staff member at that facility. And then number three is to make sure that they're getting FDA approved product. And in most cases, if you're going to the licensed facility and having your injections done by somebody who's also trained and licensed, then they're going to have access to the correct suppliers for FDA approved medications and be using those FDA approved botulinum toxin.
Right. Those are good steps. Dr. McElroy, one of the things that was mentioned here is that the counterfeit product said 150 units on the box and the bottle. That seemed to be a huge red flag. So would you recommend that patients ask the doctor or injector to show me the bottle and just make sure that it's either a 50 or 100 or 200 unit bottle? That seems to be the easiest way to tell.
I mean, patients are well within their rights to ask those questions, and we encourage them to do so, especially if they have concerns. But, you know, I would be cautious about saying, provided the dosing or provided the volume is correct, you know, you can rest assured that the product has been approved. I would ask those questions to the provider directly, like, you know, is this product that you're using FDA approved, and has it been purchased from a legitimate source?
Right. That's important questions that patients can ask. Now, we mentioned the symptoms that patients can get. They can get a drooping of the eyelid. They can have difficulty swallowing. They can have just a generalized body weakness, shortness of breath. I understand that some patients even develop constipation or urinary incontinence and things like that. Do you know when those symptoms start to occur? Does it occur immediately after the injections, or can it be several days or possibly even several weeks after the injection?
Yeah, we saw a range in the illnesses that we described from a kind of day of next day to several days after. And so I think it's kind of within that range. And again, I don't have a reason for why some people might experience symptoms sooner versus other, but that's what we found here.
So it can be variable. So the message to patients is, if you are treated with Botox and you develop any symptoms like that within a few days or even a few weeks after the injection, you should see a physician right away, or if your symptoms are severe, go to the emergency room, because if you start having trouble breathing, you could get into some serious complications.
And I would add to that, not to forget to tell your provider that you've had these injections as well. It's very important information.
Right, it is important information. I've seen a couple of patients over the years who were sent to me as an ophthalmologist because they had a slight drooping of their eyelid. And it was thought that they were having some sort of eye problem or possibly a neurologic problem. It turned out that they had Botox injection. They had the legitimate, real Botox, the safe Botox from Allergan or AbbVie, but they had a little too much injected above their eyebrow, and it kind of diffused to the eyelids. So even the real Botox can occasionally give you those side effects. But if the side effects persist or you're having more side effects, go to the emergency room or your doctor right away. Now, you mentioned antitoxin. Can you tell us what antitoxin is, Dr. Thomas?
Sure. So the CDC has a clinical consultation team for questions about botulism. And part of what that team decides is whether or not antitoxin is indicated. And if so, the antitoxin comes from CDC. They handle everything. And so basically what antitoxin is it's just what it sounds like, basically an antidote to the botulinum toxin. And it can be used in cases of botulism. And so the process is that usually the health department were alerted most often by providers, by clinicians again, about a concern. And here we're describing, a pattern of illnesses after Botox injections, but it could also be somebody who consumes a can of green beans, for example, is kind of one of the classic board questions for foodborne botulism. And they're ill and they're in the ICU. And so they call the health department, and we kind of help assess that risk, and pattern. And then we can connect providers with the CDC consultation team. There's also a direct line there. But definitely something important for clinicians to be aware of is this service, and also the availability of antitoxin for patients if they need it.
So patients are severely ill, they can't breathe, their muscles are totally paralyzed, and you can get the antitoxin from the CDC, right?
In combination with consultation with the CDC.
Right.
That's correct.
Well, that's good to know, because it's generally considered sort of irreversible, but it's good to know that there is a antidote or antitoxin that can be used in severe cases. Dr. McElroy, you're an emergency medicine physician. Do you think that ERs are attuned to this? If a patient comes in with weakness and sort of non-specific symptoms, difficulty breathing, are doctors going to think of fake Botox or counterfeit Botox in the differential diagnosis?
Or even just injudicious use of Botox by someone who's not trained.
Right, if you get too high a dose, right.
Yeah, I mean, listen, nothing will ever replace a good history. I think we as clinicians know that. It's always important to ask questions. Great if the patient is able to provide that information. But, both Christine and myself were involved in alerts that went out to providers to let them know what was going on, that we had these concerns about an unverified and in some cases proven counterfeit product, and that we also had concerns about who exactly was providing these and where they were providing these injections. So, we've done our best to educate providers and give them all the information that they need. But of course, we also want to make sure the public knows this too.
Right.
And if they have any concerns, they seek medical attention and they disclose this information.
A very, very important point. I think we covered the main aspects for patients to know, and it seems like the best thing to do is just ask a lot of questions before you get the Botox injection from a provider. Any other comments or important information about this subject that you'd like to relay?
I'll just again say, how much we appreciate the importance of clinicians in this investigation and their role that they played and their role that they will continue to play to make sure that patients are safe and well cared for. And say thank you so much for having us on your podcast. We appreciate it.
All right. It's been great speaking with you. Yeah, Dr. McElroy, you were going to say something?
And I might just add to that, in addition to asking questions, which I feel like we've emphasized, always best to exercise caution, buyer beware. If something seems too good to be true, it just might be, and you should sort of step away. And patients should remember that Botox injections are a medical procedure, and just like any other medical procedure, they should be undertaken with caution.
Right. Excellent point. I also read in the article that you published that I think in one case the Botox treatment was so cheap that it actually cost less than the wholesale price of the Botox. So if a patient is getting an incredible deal on a Botox treatment, that should raise a red flag as well.
Absolutely.
Well, this has been incredibly educational and a great topic. I learned a lot, and I'm sure the audience will appreciate the time that you've taken to educate us about this. So thanks very much for coming today.
Thank you.
Thank you. Thank you so much for having us.
My pleasure.